Hi, everyone. I'm here with Dr. Meg Haworth, and a shocking array of over a dozen illnesses sent Dr. Meg onto a path of discovering holistic methods that turned her world upside down. Her studies led her to reveal the undeniable link between illness, trauma, and how the body holds emotionally impactful memories, especially negative ones. This link would become her life's work. She now focuses on how parental narcissistic abuse can create illness in the body, and she helps clients worldwide to release the energy that makes them sick, along with the negative core beliefs that keep them stuck, with her whole person integration technique. As a holistic chef, she also consults on nutrition that helps the body to have the support it needs to heal itself. Thank you for joining us, Dr. Meg. It's great to have you.
Thank you so much for having me on the summit. It's just wonderful to meet you and to be able to work with you.
You too. So, today we're talking about healing the wounds of parental narcissistic abuse. And I want to jump in by asking you, what are the 5 primary wounds of parental narcissistic abuse?
Yeah, I think, anyone watching is just going to be able to see themselves so clearly through this. I think the first primary wound that all of us can relate to is the wound of self-worth. It's because that narcissistic parent has whittled away at our self-worth. I just call it like one painful cut at a time with the criticisms and the shaming and the blaming and the table turning and you know, you never get it right. All of those messages that they're quite literally programming us with, keeping us in that it's not even a 1 down position, it's like 1,000 down position, trying to keep us down so that they can feel superior and be in control. Because as you know, that's ultimately what they want, is to control everyone around them because they feel out of control. And that's like their shame-based disorder brings them to that place. So self-esteem, self-worth really gets worn away during the whole process of daily, whether you're shown or told, because it's a lot of it's you're being shown, the scoffing and the rolling of the eyes and all of those kinds of treatments. Yeah. So
Yes, absolutely. And so you said there were 5. Did you want
mhm.
to go through the 5? That was
Yeah.
the self-worth piece. And also,
Yeah.
before we jump into the rest of them, you mentioned narcissism as a shame-based disorder. Can you just speak briefly about that in case anyone doesn't understand that?
Yeah. So narcissism really is about shame and guilt, and within that is blame is a big part of it. So it's driven by shame. And what they've found is that most people who have the disorder have basically they don't want their shame to be touched. And as soon as it gets touched, they get rageful and protective of that. So then they project that shame out onto the people around them and make them responsible for their shame. So they're not even carrying that for themselves. So, but it usually comes through trauma. So for instance, say that your narcissistic parent was sexually abused as a child. And I think of it as like almost like a decision they make of, I'm shutting down, no love come in and no love is going out. And so as soon as the shame, which is a huge piece of abuse, being abused as a child, is embodying that shame, they're just like, nope, not going to feel it. So they're just pushing it out. So yeah, it's really heavily linked to shame, which I've found is the most dense emotion that there is, since I work mainly with the emotions and how that drains our energies,
Yeah, I really appreciate you explaining that, because I know a lot of people are having trouble understanding this narcissism that they're dealing with. This, so that does help a lot. So
Yeah.
what are the other primary wounds of parental narcissistic abuse?
Yeah, so the second one I think is one of the most damaging of them all is the wound of self-identity. So it's asking those big questions like, who am I? Why am I here? And what's the purpose of my life? Because those things are not going to be nurtured in you by a narcissistic parent. They're going to be often completely ignored. Or if you are really good at something that they're getting supply from, you're going to feel like a trained pony, like you're
Mhm.
just being used because you are being used to make them look good and for them. So that maybe, so say you were an amazing concert pianist and that was okay because you were so good at it, you made the parent look good and you made all this money from it or whatever it was, but your relationship to that identity could be really wounded and even destroyed to the point where you may not want to do it when you grow up because
Right.
of the pressure that was put on you to show up for them. And so then you may push that to the wayside and not want to deal with it. But that could be the thing that actually heals you and brings you out of the whole identity crisis that we end up having. So many people come to me and say, I don't know who I am. I feel like I've totally lost who I am. And and that makes sense because your identity is just basically crushed. It's not brought out like a healthy parent would, help nurture what you love, you know?
Yeah.
So, so yeah, so I think the wound of self-identity, and then the third one is the wound of self-expression. And so that self-expression, being able to express who you are, and of course you can see how these wounds are all interconnected, right?
Mhm.
Um, and how the abuse whittles away at those different parts of the self. And when I look at the body, I'm looking also at the energy system and how those emotional drains drain the energy field. And there's so much science behind this now, which is really exciting. And so that emotional energy and emotions have like some of the strongest charge of anything that we know in human life. And so I'm explaining this too because the center of self-expression and communication is right here. And this is a huge piece of narcissistic abuse because we get silenced.
Mhm.
I call it a prison of silence.
Yeah.
When your parent is silencing you in so many ways. You're not supposed to talk about what goes on in the house. And even if you did, they do such a good job of convincing everybody of what a good person they are.
Mhm.
I go to church and or maybe I'm the minister of the church or, so people think that this is a really good person. But meanwhile, at home, they're just abusing everybody in the household. So that center of self-expression can get drained over time. And so you may end up with chronic throat infections. You may end up with Hashimoto's disease or other thyroid disorders. So when you start looking at the holistic connections that are happening here, it becomes a really different experience of healing, of like, oh, all of these things are interconnected. Okay. So my self-expression has been basically cut off because I've been silenced. And so that wound can become a big part of what needs to happen for the person in their own healing. So, so that's what was that? The third or the fourth wound? It's
The
the
third,
third.
yeah.
The fourth is self-trust. The wound of self-trust, which we all that gets so crushed in us. And it's not just our own self-trust, but it's trusting other people. Um, we're often shown that we can't be trusted, but the truth is that narcissistic parent can't be trusted. And again, they're projecting onto everyone around them. They think everybody thinks like they think. So if they're lying and hiding, and which they're often doing, and as the kid because you're close in, and so you see them doing the lies, spinning the lies and hiding and all of that. And so it becomes incredibly confusing. But then they treat you like you can't be trusted, even if you know
Mhm.
yourself to be like an incredibly trustworthy person. So, but one of the things that I think is even worse is how it cuts you off from your own self-trust, your own ability to hear your intuition. Your
Mhm.
intuition will be heightened because you're always hyper vigilant and waiting for the next thing to happen because it's going to happen. So, but you're attuned to the negative emotions and the negative experience in the room, the negative beliefs. You're not attuned to compassion and caring and loving and kindness and empathy, even though you may have tremendous amount of empathy. They're draining it from you because they don't have it and they're looking for it. So this is one of the ways that the energy gets exchanged with this narcissistic parent, and that ability to hear your inner voice as that soft, kind, loving part of you that leads you to your identity, your self-expression, your self-worth, all of those things. Again, seeing how those are all tied together. And then the fifth primary wound are the wounds of the physical body. And so all of these things that I'm talking about, they drain you over time so that your physical body becomes so drained that it can't run your biology. And again, there's a lot of science behind this. The Adverse Childhood Experiences Study, the largest public health study ever done, really has tracked 17,000 people through Kaiser Permanente in San Diego, California. And what they found is that there is an undeniable link between the things that happened in your home of origin, the way you were treated by your parents. Your parents may have been alcoholics, they may have been narcissistic, they may have been, although they don't have a category for that. But emotional abuse is, narcissistic abuse, of course. They may have been a parent who's been incarcerated or who was physically abusive, or you watch that parent beat the other parent, or they were checked out all the time because, for substance abuse or some other thing that they were focused on. They weren't there. And so that does a lot of damage to the person over time. And so in the Adverse Childhood Experiences Study, also known as the ACE study, they found that there are specific diseases that are really linked to that. And those diseases, the top one are lung diseases. So like COPD, and lungs in Chinese medicine are the center of grief. So, and that's another fascinating thing about the body, is that it's a metaphor for our experience, and every organ system is signified by something emotional. So for instance, like I said, the lungs are the center of grief, the liver is the center of anger, gallbladder is the center of rage. So you start to see so you start to see all these connections again, these holistic connections. And I'm like, oh, I've got liver disease, or or I've got kidney problems. That's the third center, that's center of personal power. So that's how I'm sort of linking everything up so people understand how the body gets drained over time from these negative emotions, thoughts, feelings, and beliefs, and then how we can become sick. And some people will say, well, they come to me and they'll be like, well, I'm not actually sick. But then I'll start talking to them, say, well, I get headaches a lot, or I have all these chronic symptoms. And the doctors maybe even said, hey, there's nothing wrong with you. There's nothing showing up on your labs. You're fine. It's all in your head, but you've got headaches every day, or you've got chronic throat infections, or your knees hurt all the time. Or you've got tennis elbow, but you think there's no connection between that and what happened, but there always is an emotional root cause to everything that happens in the body. And sometimes it's more dominant. Sometimes it's the food is more dominant, or the environment's more dominant. But all of these things are connected.
Wow, this is fascinating. And I know anyone listening who was raised by a narcissist is going to relate to what you're saying. They're going to have felt those things. I know I was raised by a narcissistic mother. And when you were talking about the throat stuff, when I was younger, before I got on this healing journey, throat infections, sore throats, always being on throat medication and cough medicine, that was almost normal for me. And when you talk about these symptoms, these symptoms that we don't even realize we're sick or suffering from something chronic, that just feels like life to us. And so thank you for bringing light to that. I know a lot of people will relate to it for sure, and find hope in knowing that it doesn't have to stay that way.
Yeah, absolutely. Your body's really, it's crying out for help. And your body's holding that memory and those energies, and you can release them and you can get better. And especially when you take that holistic approach.
I love it. And so, why do you believe that the energy system is the most important part of a person?
Well, ultimately, we are made up of energy. So, and our energy system is the only permanent part of us. As I often say, it's the only thing you come into this world with and you leave this world with. And then while
Mhm.
you're here and that energy system is in motion, that's the time that you can work with it, you can release it, you can let go, learn and evolve. And I think it's the most ignored part of the whole system. And it's the
Mhm.
most important part because I've watched things heal up overnight when they got to that emotional root cause because the body knows exactly what to do once you give it the right things that it needs. And sometimes it just needs an energetic tune up or an energetic release that, has been wearing away at you for so long. And let me just give you kind of an example too. So resentment is a huge one I see, especially connected to people with cancer. It's long held resentments and anger. And we have to push our anger down. We're not allowed to express it or feel it. If we do, we get in massive trouble when you have a narcissistic parent. And
Mhm.
so that energy of resentment can get held in your field and keep spinning. And originally, we use it as a way to protect ourselves almost. But it gets to a point where we don't need that anymore. And it's actually wearing away at us. It becomes more of like a poison to our systems. And so releasing that resentment, letting it go is so important. So, and that's, part of what I help people do.
Yeah. So when you talk about being able to overcome something almost overnight,
Yeah.
that's very exciting. And that is
Yeah.
very hope-filled for someone who might have been struggling with this for, even decades. So can you give like a small example of what that would look like or how something seemingly miraculous could happen?
Yeah, absolutely. So I had a cancer patient I was working with, and she had a tumor on her tongue. So she had reference to it getting bigger or smaller. And one of the things, poor thing, her tongue had split because the tumor was getting bigger. And she found my work somehow, and she knew that the abuse that she suffered as a child, like her father would leave a paddle on the counter as a symbol of you can get hit at any moment.
Mm.
And so she was always just in that hypervigilant state, and she'd formed a lot of resentment around that and didn't realize how much. And so when we used my technique, whole person integration technique for her, we went in and really looked at like what is she holding in that tongue? And incidentally with canker sores. And so I said, well, what happened in the last few days emotionally? Did anything happen? And she's like, oh, yeah, I talked to my dad. So there she was
Mm.
dealing with cancer, telling him, I can't talk to you because
Mhm.
I can't, I'm trying to heal here and this is too hard for me. So she breaks out in these canker sores. So we did the technique together. She released the resentment. She got to the negative root cause and that memory that was attached to it. And then, literally overnight, the canker sores healed up and the ridge on the tongue healed up. The tumor did not go away, but it was a significant difference, huge. She said it was one of the best days of her whole life just to even know that that was possible when the body was given that release. And
Mhm.
really, it lets us know that emotions play a significant role in our health and in our illness, but also in our wellness. So, and that's a huge
Mm.
part of the focus of my work is emotional wellness.
Wow, that's beautiful. That's really amazing. Is there anything else you want to tell us about this technique? Because it's really fascinating.
Yeah, so whole person integration technique is done. I can do it with anyone, anywhere in the world. Your eyes are going to be closed, so you have reference to your body and to the subconscious mind. So you can feel like where are you holding that emotional experience? And then we talk to the emotion itself, which takes you out of your own story. Because when you get into your own story, I watch clients just do this. They just
Mm.
that we get into, and the nervous system kind of shuts down. And so this kind of bypasses that and helps them look at the emotion. So maybe they're dealing with resentment, and maybe they're feeling it in their stomach and they've got ulcers. And so we look at that emotion and how it's connected with that, and the experience of the emotion itself again, and what it believes, what's its core negative belief. So, and it's really fascinating to see the things that come up for people, the images they get when I say, what does your resentment look like? And they may say, well, it looks like this cartoon character of this, somebody who's just been electrocuted or so, it's like, and so it sort of starts to take the edge off of the experience, because it's like, that's kind of a funny little image. Like, why would that happen? But that's part of how the subconscious mind gives us, speaks to us. It's in symbolism, archetypes and symbolism. And so these emotional archetypes and their beliefs and the symbolism that they hold and how they're held in the body. Once you see that whole picture, you're just like, I don't want that in there anymore. So then we do the release process. And then very important is the replacement process, because that's what we want to feel. We want to feel compassion, kindness, peace, love, caring. And that's always my prescription after the session. It's like, well, you want to bring in peace? Let's flood your body with peace. Because we know that when your body is flooded with these emotions, they'll make us sick, but they'll also make us well.
Wow. Wow, that's amazing. And also, I know you're a cookbook author and a
Yeah.
chef. And so, of course, I want to ask you about the food aspect of healing. So, how do you recommend, or how do you help your clients use food to overcome some of these wounds?
Yeah, food is so important while you're doing your emotional release work, because it's the baseline for everything that we do, on the physical. And if you think about, everything is energy, right? And the energy of your food is incredibly important. So the higher the quality of the food, the better it is for you. So you want things that are organic. And I know I can hear people, I can't afford organic. And believe me, I couldn't either, but I made it. I made it work. I just,
Mhm.
because it was so important to have that energy and that frequency of the fruits and the vegetables. And then I also do recommend proteins, meat proteins, but again, organic if you can get it. If you can't, just eating real food in general, cutting out the processed foods and the food chemicals. We now know that so many of these food chemicals cause anxiety, they cause depression, they cause rageful fits. Personally, gluten was one of the things I was highly allergic to. And I would go into rage when I would have gluten, and then massive depression, just like crying jags. And when I cut it
Mm.
out of my life, and then of course did the emotional work, I don't have those issues anymore. But if I get a significant amount, like if there's something in a food I'm eating or something, then I can, have that again. But then I know what it is, and it clears in a couple of days. And I use my technique to clear anything out that emotionally might have happened, um, as well. So, but food is incredibly, incredibly important. There's an entire category of anxiogenic foods, foods that cause anxiety. So, learning what those are and eliminating them from your diet or swapping them out. There's so many swaps now. It's so great.
Right.
I mean, I went through this whole food thing 30 years ago when there was so little out there. And that's part of why I wrote the cookbook, because I had to come up with,
Mhm.
well, how am I going to have a birthday cake? How am I going to have pizza? How am I going to have cookies? How am I going
Right.
so that's really that first cookbook that I did, done with dairy, giving up gluten. It's 14 days to a delicious and healthy you. These are like the recipes you want. Things like chicken piccata that you can, usually they're dredged in flour, and then they're done in butter, so then I give you all those swaps that you can use so you can still have something
Wow.
yummy. So
Now, this is the first time I'm hearing about anxiety producing foods. And obviously, I know I'm not the only one. A lot of people watching this, I'm sure, will be surprised to hear that foods can create anxiety.
yeah.
Can you give us just a few quick examples of some of these foods if anyone wants to avoid them, even just starting today?
Yeah, some of the primary ones are food chemicals, like food dyes.
Mhm.
Red dyes, the red dyes are some of the worst ones that have been associated with rage. I've watched it happen with children. They get some red dye and then they just have massive meltdowns. So paying attention to food colorings, that's really important. Uh, MSG is another big one. So basically, it's an excitotoxin. So that means your brain cells literally explode, but you become addicted to it because there's a feeling that goes along with it, sort of a euphoric, which makes no sense when your brain cells are
Right.
exploding, right? Um, but I know like if I get any MSG, I get really dizzy and I'll be dizzy for about 24 hours, like vertigo, you know, like it's hard to stand. So start
Mm.
looking at, do I have that symptom? And oh, could that be caused by the food I'm eating? Because it really very much possibly can. Gluten and dairy, soy and corn in the US, huge problem because of the way they're farmed. Unfortunately, I know
Mm.
so many people go to Europe, they can eat anything.
Right.
Here, they get super sick because they're spreading glyphosate, which is Roundup, to ripen the crops. They do that with now they're doing that with lentils and chickpeas, unfortunately. So get organic if you're going to eat any of those corn, soy, lentil, chickpea. Um, Berries are a big one that have um, poisons on them that could also make us very, very sick, that can cause cancer. And we know this in this country. It's
Mhm.
really so backwards the way that the whole system works. It keeps us wrapped up in Western medical and using those drugs to try to offset all of these issues that we could have really prevented had we just eaten real food in the first place.
Yeah, and that's so helpful to know, even me listening to you here, I'm going to be making sure that when I have the choice, I get the organic. I'm lucky enough to have a grocery store that offers a wide range of organic. And to know that it is very much worth the extra cost because of how
Mhm.
it's going to affect my health. I really appreciate you
Yeah.
letting us in on that. And now that we're coming near the end of our talk, I wanted to ask you if there's anything, any last words you wanted to share with the audience.
Yeah, I often say this in interviews. I think one of the most important things we can do is take our healing into our own hands, learn to follow that inner voice, and find the practitioners that are going to help us, that are going to hear us. When you go through narcissistic abuse, you are not seen, you're not heard, you're not understood. And so finding people that can help you through that process on all levels, mentally, emotionally, physically, and energetically and spiritually. And I'll leave you with one thing my mom used to say every time before we hung up the phone. She passed away almost 2 years ago. But she was a scientist and she was one of my biggest supporters and also one of my biggest inspirations. And she used to always say, take good care of my baby before we hung up the phone. So I always say to people, take good care of your mom's baby. And if your mom
Mhm.
was the narcissistic parent, I'm so sorry. It's very hard to navigate that, but that you can love yourself and become the mom that you always wanted and never had. So just take really great care of yourself, and you'll heal. Just focus on you.
Mhm. Yeah, that is such wonderful advice. And reparenting can really be an inside job. So I appreciate you sharing that with us. Thank you, Dr. Meg. This has been a wonderful, very eye-opening conversation, and I really appreciate you.
You're welcome. Thank you so much for having me.